Are you suffering from the elbow pain with activity, gripping or pushing onto something? You're first thing in the morning and really stiff in the elbow? Then I have this routine for you, which is a combination of stretches and strengthening. A lot of time you try so many strengthening exercises, but your muscles need stretching. Then you need a stretching, because that is not replacing by using the strengthening. So this routine is designed to use your flexor and extensor muscle for stretching. Same way with extensor, flexor and rotators in your elbow to strengthen it. Let's dig into it without any delay. So first of all, we can look into stretches, and before we do that, I want to warm up this area, especially the joints. So for the warm-ups, we want to roll these joints, especially the wrist joint. All the elbow muscles are here, are attached in the side of the elbow, are the wrist muscles. So we want to roll it. So you start with rolling for at least 5 to 10 reps in and out and in and out on the both sides. You can do this way. Once you finish the warm-up and the rolling, we are going to do stretches. Now stretches are very important for both muscle groups. So the top muscle is called extensor muscle group and the back is called flexor group. We're going to stretch it. So how do we stretch it is, you go and keep your elbow straight, and then we are going to bend the wrist just like this. So you're using the other side to use and support, and you're going to stretch here. You should feel a good amount of stretching on the top part of your forearm. When you do this, you don't want to strain the wrist. Make sure we are not straining the wrist. You're not overly pressing. As soon as you feel the stretch, just stop and enjoy the stretch and let it stretch. You do this for 10-second hold and 10 reps. Now with the opposite muscle group, which is flexor, we can do similar but opposite. Using the other hand, you're going to keep the elbow straight. We are going to pull towards yourself. Now this is stretching the flexor group, which is the opposite of the extensor, and these are the two groups we can stretch. Now when you get a flexor tightness, you get a golfer's elbow. When you get extensor group tightness and irritation, you get a tennis elbow. So we are stretching both of them. 10-second hold here, 10-second hold here. And that's it for the stretches. You can do the both side, right and left, at least giving you some relief before you start strengthening. Now strengthening is very important where you have a good amount of numbers. So we need to make sure that you do a good amount of reps and sets for the strengthening. Stretches you can do here and there and make the muscles looser, but strengthening is important here. So first of all, we're going to work on the flexors and extensor group strengthening, and we can use 1 or 2 pound dumbbell or the resistance band. So here I have a dumbbell and resistance band. I'm going to show you how to use both of them. So first of all, let's try with the dumbbell. So what you do is, you can sit on the edge of the bed or a table, or you can stand. Make sure we support the elbow, so that way you're not feeling in the shoulder. You support the elbow and you're going to drop the wrist down just like this, and then we're going to lift up. We're going to drop down and lift up. So this can be done 15 reps, 3 sets. This is strengthening part, and we want to strengthen the forearm extensor muscles. This is what we are working on right now. So you can do this 15 reps. Once you finish 15 reps, we're going to turn other way, which is the flexor group. Again, we want to keep the elbows supporting, and this way we can do another 15 reps, which is for the flexor groups, and then you can turn around and do the same thing, 3 sets of 15. So this dumbbell we can use for that. Now similarly, if you have a resistance band for the wrist, you don't need really good amount of strength. You don't need it. It's very gentle, small muscles in the wrist, so you need a light resistance. So same thing you can do is, you can put the band somewhere, and we are going to strengthen it with extension, and then we lift up. We turn the palm around, we turn the palm around, and we can do in a flexion. Again, 15 reps, 3 sets. Whether it is dumbbell or the bands, we can use that. Third exercise is the rotation, which is called supination and pronation in the wrist and elbow. Supination, pronation, again you stabilize it, and we can use a dumbbell to hold on the side of the dumbbell. So your other end is hanging and we are going to rotate. And when we rotate it, we are getting a good amount of rotation here, but at the same time we are getting good resistance. Now you can also try the hammer here if you feel like dumbbell is hard to hold, but this will make you tired because these muscles are small muscles and they are designed for the fine motor activity. They're not designed for strength heavy activities. But when you do heavy and those muscles are not ready, you injure it. So these are the exercises you can do to help strengthen it, so you're getting used to it, that motion, and it's easy for you. So this is the 3 exercise. The 4th exercise is called eccentric control. All of these are concentric. Eccentric means you do opposite motions. Any tendonitis needs eccentric control because it loads the muscle more and less the tendon. So it technically deloads the tendon. How do you do is holding this same way, we are going to lift up using the other side and then let it drop. So when you drop it, it's eccentric. When you lift up, it's concentric. So we want to avoid concentric because that affects your tendon. So these are the exercises we want to try. 15 reps, 3 set is what we want to do. Now, if you feel like you're getting pain with these exercises, maybe the resistance is not right. Meaning you're using too much resistance or too many reps, because a lot of these are chronic issues and it can take a long time to heal. But if you're doing right amount of stretching and right amount of strengthening, you can start feeling better really quick. So this is the part where if you like this, you can subscribe, and if you feel like you have chronic back issues, neck issues, I have other videos, you can take a look at it. So there are some research based, it is very much evidence based techniques, and you can also follow along with certain exercises. Thank you for watching.